Good afternoon. Thank you for joining today's webinar, Uncovering Hidden Disabilities in Today's Criminal Justice System, Understanding Intellectual and Developmental Disabilities. My name is Deirdre Assay. I am a policy analyst at the Council of State Governments Justice Center, and I will be moderating today's webinar, which is hosted by the Bureau of Justice Assistance, the National Center on Criminal Justice and Disability, and the Council of State Governments Justice Center. For today's webinar, we are excited to be featuring three speakers. Leigh Ann Davis is the Director of the National Center on Criminal Justice and Disability. Maria Fryer is the Policy Advisor for Substance Abuse and Mental Health with the Bureau of Justice Assistance at the U.S. Department of Justice. And Dr. Karen Harvey is the Director of Clinical Services at the ARC Baltimore. I will now turn things over to Maria to talk a bit about the Bureau of Justice Assistance.
Thank you, Deidre. The Bureau of Justice Assistance is a component of the Department of Justice Office of Justice Programs. It provides leadership and services in grant administration and criminal justice policy development to state, local, and tribal jurisdictions. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crime, and combat victimization. Through the development and implementation of policy, services, and sound grant management, BJA strengthens the nation's criminal justice system and restores security in communities. The Bureau of Justice Assistance supports many initiatives that help communities address their state, county, local, and tribal responses to people with behavioral health issues. BJA and their training and technical assistance partners help communities to effectively implement and improve program outcomes to see positive system-wide change for justice and mental health professionals and the people they serve. One program that effectively puts this into practice is the Justice and Mental Health Collaboration Program, which supports cross-system collaboration among law enforcement and behavioral health providers to improve responses and outcomes to people who have mental illness or co-occurring substance abuse. BJA supports other initiatives to assist in this effort, such as Pathways to Justice through the National ARC, and Serving Safely, which is a new national center to support law enforcement, along with other training and technical assistance partnerships like Stepping Up and web-based resources like PMHC Toolkit, and also the recently added national curriculum to effectively respond to people in mental health crisis. Thanks, Deidre.
Thank you, Maria. The Justice Center is a national nonprofit, nonpartisan organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. The Justice Center has developed a number of resources, including adults with behavioral health needs under correctional supervision and integrated reentry and employment strategies. Before getting started with today's presentation, I'd like to briefly walk through some housekeeping items about the webinar. Anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will address them all at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues that you may not be able to resolve. For this reason, we are recording the webinar and we will post it on our website. We should have the webinar posted online by the end of next week. And now I will turn things over to Leigh Ann Davis to talk about the ARC and the National Center on Criminal Justice and Disability.
Thank you, Deidre. So I just wanted to give everyone listening more information about the ARC. The ARC has been around for a long time, over 60 years. We're the largest disability rights organization in the country. And we have a total of over 650 state and local chapters throughout the country. We advocate for people with intellectual and developmental disabilities in a number of different ways. We provide services and advocacy through our chapter network from birth to grave, so all ages, as well as in many different areas, including employment and healthcare. And the area that we're talking about today is regarding criminal justice issues. So we have a national office in the ARC of DC and have been working within criminal justice issues specifically for a number of years at the national level, and more recently, as Maria talked about, through support through BJA, where we were able to establish the ARC's National Center on Criminal Justice and Disability. So we just want to thank Maria and Council of State Governments for this opportunity to talk more to grantees and others in the behavioral health field of what intellectual and developmental disabilities are and how to ensure that we are able to serve their needs as well. And a little bit more about the National Center on Criminal Justice and Disability. So our center that operates within the ARC, the National ARC in DC, was created in 2013, as I said, from a grant from the Bureau of Justice Assistance. And the goal of this center is to really advocate at that intersection of both criminal justice reform and the advancement of disability rights. So we look at working on both victim-witness issues as well as those who are charged with crimes. We feel it's very important to take a comprehensive look at this issue, and we know that people with disabilities are more likely to be involved in the system as both. So through our center, we've been able to create training, as Maria discussed briefly, the Pathways to Justice training, as well as webinars and white papers on topics that are really difficult at times and it's hard to find information about. So we've tried to look into the field to see where there's a lack of information and really fill that gap in that way. And Deidre, I believe you're going to talk about learning objectives?
Yes, thank you. After today's session, attendees will know the differences and similarities between behavioral health diagnoses and intellectual and developmental disabilities, learn how to identify someone with an intellectual or developmental disability, learn interaction and de-escalation tips, know the law that provides protection, and consider potential partners for next steps. Before we jump into learning about intellectual and developmental disabilities, Maria will walk us through an overview of behavioral health.
Thanks, Deidre. So these are very complex issues, and I'll provide a high overview of the behavioral health piece. So making the distinction between behavioral health disorders and intellectual and developmental disability is important for a number of reasons, and one is for recognition purposes, and another is for effective communication, and another may be for the reason of connections to appropriate services. Behavioral health and or mental illness falls into the buckets that you see on this slide and are included in the DSM-5. We use the term behavioral health to be more inclusive of substance abuse and intellectual and developmental disability and other types of behavior. Next slide. Thank you. So as we mentioned, both people with mental illness and people with intellectual and developmental disability can present similar behavior, but recognizing the possibility of one or the other or both is really important. And some people with intellectual and developmental disability may also experience mental illness, which we refer to as dual diagnosis, but the two conditions are still very different. Whereas mental illness involves severe disturbances in behavior, mood, or thought processes or interpersonal relationships, intellectual and developmental disability involves processes that involve cognition and understanding. And both populations can have difficulty with relationships, but for different reasons. People with intellectual and developmental disability can have difficulty with interpersonal relationships as well, but for different reasons, such as the ability to process information or difficulty communicating or speaking or having a poor ability to cope with certain situations and perhaps acting out or displaying behavioral symptoms as a way to communicate. And a person with mental illness may communicate in a way, perhaps they're having a condition that produces different delusions or different kinds of paranoia, and they may be communicating in a way that's recognized as that. It can be difficult to distinguish between a psychiatric disorder and a visible behavioral issue because often certain behaviors are used as coping mechanisms for a person with either intellectual developmental disability, even mental illness, and sometimes even certain events can trigger certain types of behaviors, and it can be very, very difficult sometimes to notice the differences. And the full range of mental illness that is found in the general population can also coexist in the population of people that have intellectual and developmental disability. So the two can occur actually at the same time. Next slide. So here, we're given some food for thought on this slide about what it means to be a person with perhaps both mental illness and intellectual and developmental disability moving through a system such as the criminal justice system that's already experiencing difficulty serving one population or the other. And we have to ask ourselves, are we readily including people with intellectual and developmental disability as we're responding? We're challenged today here to think about what we currently recognize or understand as behavior and learn how to recognize that the person that you're responding to or working with could be a person with intellectual developmental disability, and to think through appropriate responses and connections to care. Confusion about mental illness and intellectual and developmental disability carries over into the criminal justice system from the general public's need for greater understanding. We are going to talk through today through some of the differences, and we hope that this webinar is helpful. And as you participate in today's presentation, we encourage you to think about the people that you may be coming into contact every day. Next
slide. Thank you so much, Maria. Before giving an example of one of the challenges of working with people with intellectual and developmental disabilities in correctional settings, we would like to find out a little bit more about who is logged in through a brief poll. Please select the statement which best describes your jurisdiction's ability to respond to people with intellectual developmental disabilities. My jurisdiction has the resources to respond effectively to people with intellectual and developmental disabilities. My jurisdiction is trying to engage people with intellectual or developmental disabilities through the behavioral health system, or I am unsure of how my jurisdiction is responding to people with intellectual and developmental disabilities. We will give a few moments for everyone to enter their response. Okay, we're going to close the poll, and then we'll look at how everyone responded. Okay, so it looks like we're pretty evenly distributed between all three responses, with 21% of people choosing the first response, 24% choosing the second response, and 21% unsure of how their jurisdiction is responding. Jail staff sometimes reports challenges in responding to detainees with intellectual and developmental disabilities. For example, in jurisdictions where law enforcement has no discretion in domestic violence calls, the aggressor might be brought to detention. Law enforcement and jail staff may realize that jail is not the appropriate intervention for someone with an intellectual or developmental disability, and often the family doesn't want their loved one brought to jail, but law enforcement may not have any other options. One jail gave the example of a young woman who had a diagnosed IDD and lived at home with her father. At times, she would become physically aggressive, and her father had to call police. Jail staff was aware of her diagnosis and tried to do the best they could. They would keep the young woman out of the housing units, instead allowing her to watch movies until her father could come pick her up. But staff still hoped for a better solution. We hope that at the end of today's session, staff will feel better equipped to respond to situations similar to this. Leigh Ann?
Hello, making sure you can hear me.
Yes, we can hear you. Thank you.
Okay, thank you. Well, thank you, Maria, for providing that great overview of behavioral health and also for the poll that really gives us a better understanding of where people are in terms of supporting this population specifically. And I wanted to get started just by giving a broad overview of why it's so important for criminal justice professionals, those working in behavioral health, to understand what intellectual and developmental disabilities are and how that can impact people who are in the system. We know that they are overrepresented in jails and prisons, and I'm going to get into some of the statistics on a later slide. Also, they're often hidden in terms of being a hidden population. These are not disabilities that are readily seen, and unless you start talking to a person with these types of disabilities, it's very hard to discern right off the bat that someone may have a disability. So that's another challenge we see. There can also be confusion or misunderstandings about if the person has a mental illness versus an intellectual or developmental disability, as Maria touched on, and then they're more likely to be victimized as well, or they might be used by others in prisons, in jails, in correctional settings. And then another important reason is to understand what the law is regarding the Americans with Disabilities Act, and that criminal justice professionals understand that there is liability at stake for that, and understanding that ADA is not just a nice thing to do, but it's the law. So we need to understand in our field that that there's a way to apply the ADA and to understand basic accommodations and how to ensure that we're serving this population specifically. And I wanted to, in order to sort of provide this information, give you a context of how we're going to be talking about this today. And what I'd like to use is our Pathways to Justice training. So you'll get an understanding of how this training could work, and how we provide this information to people that we train. And within these trainings, we talk to law enforcement as well as victim service providers and attorneys. And we work with people with disabilities to come together and talk through these issues. And we break it down into 4 steps of saying how do we best support this population specifically. And the first is how do we identify disability. So we'll talk a little bit about that, then communicating as well as assessing the situation, what are ways to de-escalate situations, and then what are supports that we need to be providing, whether it's within the community or individual supports, and how does that look. So we'll use that format today to talk through this. And I wanted to introduce to you the Pathways to Justice model. As you see in the upper right-hand corner, you'll see the steps that I just mentioned on the previous slide there. This is the model that we use, that we would actually take a case scenario at the beginning of the training and walk through these steps with law enforcement at the table, as well as the victim service providers and attorneys, to really talk through where are the challenges in the system, where are the barriers that we're not being able to serve people with these types of disabilities in the system. So, for example, the scenario that Deidre just gave us, if we're looking at the model, we could look at the section there in green in jail and ask, you know, were accommodations provided to the female who was taken into custody and then into incarceration. And so we could look at that and say what types of accommodations were provided. And it does sound like that the jail staff were trying to provide those accommodations. But as we move on through the model, we have to ask, what are the long-term accommodations that we are providing as well? So in this situation, the person could simply be cycling through the system because although an accommodation was provided at that point, we're not providing a long-term solution if the person isn't able to, for example, address what the anger, how that anger is happening, address what's going on in the home, what's causing that situation to occur. So we really want to be able to use this model to think through in our communities and in the systems that we work with, are we getting to the core issue? And that might look different for someone with mental illness versus someone with an intellectual disability. So that's just sort of a broad overview of why it's so important that we have these discussions. So step one is looking at identification. And in this section, we really kind of delve into what is developmental disability and intellectual disability. And so I'm going to pass it on to Karen, my co-presenter today, to give you more information about the basics of developmental disabilities.
Hello, everyone. I am so excited to be able to do this. And I have to say, it's such an honor to be with this incredible panel. And I really appreciate BGA, the Justice Center, and the National ARC. This is such important work. And more so, or just as the same, I appreciate all of you. To me, this is the invisible population. They're missed. They're neglected in many cases. They have tremendous levels of trauma, and they get caught in the system without their needs being met and often not even identified. So this step of identification is really a critical one. Okay, the next slide. I'm trying to change the slide. Here we go, yay! So with developmental disabilities, what we're talking about are people with a disability before the age of 22. So there may be folks with head injuries that occurred after that or other kinds of degenerative issues, but those are not the people that we're addressing today. We are talking about people where either it occurred from birth or, somewhere before the age of 22. We see a lot now of what's called regressive autism, which is a really tragic situation where people are developing autism between 18 months and 2.5. We see all different types of situations. So they have to have that physical or mental impairment, and then in at least 3 areas of adaptive functioning to have a significant limitation. So there are going to be limitations in either self-care, learning, walking, or some kind of ambulation, self-direction, independent living, and economic self-sufficiency. So in terms of developmental disabilities and intellectual disabilities, there are many different types. So you might be working with someone who has cerebral palsy and does not use words, but is actually brilliant. Just a developmental disability does not mean that there is an intellectual disability. Oftentimes people can't use words, but there's a lot of understanding and a lot going on. So we want to always see, are they using assistive technology? Is there a device by which they can talk? We look at other disabilities. So we have a lot of genetic disorders that we've now identified. Of course, they're the common ones, Down syndrome, Fragile X, but we're identifying more and more less common genetic disorders. And we see something called a behavioral phenotype, which is that there's certain behavior patterns that are associated with certain genetic disorders. So they're good to know, and that's why these trainings are so important. So if you're working with somebody with Down syndrome, they might tend to be particularly stubborn, prone to depression, and often have early onset of Alzheimer's. People with Fragile X syndrome will have social anxiety and may start to have a meltdown in a social situation that will look like they're trying to cause trouble, but really they can't hold themselves together because of the extreme anxiety. We have fetal alcohol syndrome, sadly a very common disorder where now we say it's a spectrum disorder because there's all different degrees. And we used to think, well, they all show up as facial features, but less than 25% actually show the facial features. And those folks have difficulty connecting cause and effect. So they may find themselves in a bad situation, having committed an offense and not understanding what they just did. Autism, which we'll be talking about later, I think is really critical to understand all the limitations and the ways that we have to communicate and support people with autism. Epilepsy, seizure disorders, you know, and very sadly, many people with severe seizure disorders experience a cognitive deterioration because of that chemical activity, electrical activity, excuse me, in the brain. So that's just a little bit of what we look at when we look at the broad range of disorders. So if you know one person with an intellectual or developmental disability, you know just one person, because each disability is so unique and so different. So we really can't make, you know, broad generalizations. I think as Maria pointed out, there's the dual diagnosis. There's so many complex issues, and each person experiences that. So as we proceed further, and as I click my slides, I don't know why here we go. Oops, sorry about that, gang. Okay. This is, I don't know, for some reason I'm not able to, here we go. I apologize that I have trying to get to, there we go. I'm sorry, guys. This is me. I'm clicking on this arrow and it's not going well. Meanwhile, you know, I have my own disabilities. That's why I'm so drawn to this field. But intellectual disability, that's of course what we see as a type of developmental disability. And, you know, we have both, you have to have the origin before actually 18 or 21. We have the adaptive behavior, as we said earlier, and that significant lower IQ. Oftentimes, people with trauma and extremely difficult circumstances or neglect may not be able to pass an IQ test, may test as having an intellectual disability because they're so fragmented. So we see that the intersection of mental illness and developmental disabilities oftentimes, and people cannot function cognitively, and yet there's a lot going on there and a lot of potential there, but they've been victims of levels of abuse as well. So it's a very complex situation when we look at intellectual disabilities in the broad range. So now, you know, why some people call this, when we see this a lot, as a hidden disability. So you may be in a situation where you're dealing with someone from the public, they're committing an offense, or there's a situation, or there's drama, and they are clearly and deliberately trying not to present as having an intellectual disability, because I know many people that I work with, and I'm a clinician, I've worked in this field for over 30 years, are very concerned with appearing as though they don't have a disability. So they will try to act like they know what they're doing. They will try to present like, yeah, I'm good, I get this, and when they don't understand at all. Also, there's a term called counterfeit criminality coined by Dave Hinsberger, where people are not really criminals, but they're trying to fit in with a group. So they're doing everything they can to be a part of the group, but they're the one left holding the bag because they don't want to be rejected. They want to be a part of the group, and yet they're the ones who get caught sometimes in criminal situations. So we see a lot of this as well, people trying to hide their disability because they care so much, you know, to be able to be considered normal, which is really heartbreaking. Now, okay, next slide, here we go. So the psychiatric disabilities. So there's a large, you know, it's actually pretty controversial, the level of mental illness among people with developmental disabilities. I've seen different statistics. I've seen 70%, I've seen 35%, but the reality is that there are a lot of mental health issues with folks with intellectual disabilities. And, you know, we see depression, schizophrenia, bipolar disorders. We see all kinds of issues, and there's a phenomenon called diagnostic overshadowing that often occurs, that because they have an intellectual disability, because they come across as someone who can't really function cognitively on the same level that other people can, the psychiatric disability gets missed, and they don't get the treatment that they need. And we see that occur as well, and people are often misunderstood as both Leigh Ann and Maria referred to, you know, these behavioral issues occur, but they're really symptoms. They're symptoms of mental illness. They're symptoms of trauma. There's someone who's, you know, having a meltdown due to that anxiety or maybe the tendency connected to their genetic disorder. They're not deliberately trying to do something bad. Their intent is not there. And yet we look at that behavior, I've done it too, mistakenly as, oh, this is, you know, deliberate and intentional, where really it can be a symptom of a psychiatric disability. So we see this intersection, you know, of the developmental disability and the psychiatric disability. And we see that, you know, we may have folks that we can't really see what's going on. That's why that assessment piece is so critical. And when they are in the system, when they have been jailed or whatever has happened, we've got to do that assessment to look at what's really going on. And now I'll turn it back over to Leigh Ann. And, or is this me? Okay, one more. So with the psychiatric disability, as I'm saying, sorry, that after this I'll turn it over to Leigh Ann. So the real critical issue is that we go deeper, that we do the assessment, that we look beyond what that behavior is. We see, is there a dual diagnosis? Is there a psychiatric issue going on? Is this behavior just a symptom of a deeper issue? Is there trauma? Often people are having trauma responses, and that's critical to recognize as well. Thank you.
Thanks, Karen. So, yeah, it's really important to have that understanding of dual diagnosis. And I might add that when Maria talked about dual diagnosis earlier, within the behavioral health field, it can actually mean something different than in the intellectual and developmental disability field, because in behavioral health, it's often referred to as people with co-occurring mental illness and substance abuse disorders, whereas in our field, there's actually a national association on dual diagnosis that is focused on people that have both intellectual or developmental disabilities and a mental illness. So what's interesting about these different fields is that we do have different terminology, and one of the things that we are discussing is, you know, what terminology can we use so that we can have conversations when we're talking about how to provide accommodations and who are we identifying in the system that needs support. So that's something to think about too as we continue through the webinar today. So I wanted to give you as well an overview of challenges that people specifically with intellectual and developmental disabilities face in our criminal justice system. And I've been working at the ARC since 1994, so I've been working in this area for roughly 22 years, working to really, you know, pull apart these different challenges. Now, I will say that this in no way is the full list of challenges, but these are just some things that we thought it would be great for you to have an overview about. And probably in your work, you've seen this within the behavioral health field as well. So we know that false confessions can be common due to a desire to please. We have seen, you know, that people with intellectual and developmental disabilities often do have a very strong desire to please those in authority. And this has actually been a learned behavior. It's not something innate in people with disabilities, but it's something learned over time because of their history. You know, they have early on, in fact, why the ARC started was because parents were being told that children should be left in institutions. And then people with disabilities have not traditionally been able to live in the community and to learn how to use their voice and make their own decisions. So all of this really impacts people when they come into the criminal justice system, as you can imagine. And so we see false confessions pretty often. And in fact, recently you may have heard of the Netflix documentary, Making a Murderer, where there's been a lot of focus on the Brendan Dassey case, who was he gave a false forced confession regarding murder. So that is actually going possibly to the Supreme Court. and advocates are following that closely. But there have been many cases where people have given false confessions. We have a list on our website who were later found to not be guilty of the crime, and thanks to DNA evidence, we do have a better way of showing just how often this has occurred. So we definitely watch for that. We know that people with IDD are placed in institutions to, quote, regain competency, which is really hard to do. If you have an intellectual disability, it's not necessarily something that people with IDD can do, is to regain competency. Now you can learn more about the court system to a certain extent, but what's happening is people are ending up in these holding facilities and for all intents and purposes are incarcerated, waiting to regain competency. And I've heard from different states where this can go on for years. They're often unable to assist in their own defense, so unless they have a support person with them, they may actually also, waive their rights unknowingly. So they don't have that deeper understanding of their Miranda rights. They may not understand how to help attorneys, and this can be a big strike against them in the system. Also, it's important to realize that people with disabilities have barriers when they're victims of crime as well, and they may be denied their right to speak because their testimony is not seen as credible. And that goes back to stereotypes. And we talk a lot about that in the Pathways to Justice training and how stereotypes really affect how criminal justice professionals and really society at large views people with disabilities. And we have to think about how do we address those. If you don't know someone with disabilities personally yourself, I think we can jump to conclusions about anyone. And so it's thinking about how do we ensure that people with disabilities have the same access to the criminal justice system as anyone else without a disability. And again, people with intellectual disabilities seem to have even greater challenges in this way. So I told you earlier that we would look at some of the statistics. So we know that people with intellectual and developmental disabilities can represent from 4 to 10% of our prison population, and that's not even counting those who are in our juvenile facilities and jails. And NCCJD did a white paper specifically on juvenile justice issues, and it really is astounding the number of juveniles in our system that have some type of intellectual developmental disability. We also know 32% of prisoners and 40% of jail inmates have at least one type of a disability. So that's looking at, physical, cognitive, all types of disability. But that is compared to 11% of the general population that has at least one disability. So you can see the rate is quite high there. And then in another study, we found that 2 in 10 prisoners and 3 in 10 jail inmates report having a cognitive disability. And I should point out that cognitive here means the person could have either a mental illness and an intellectual and developmental disability or both. So one of the limitations of our data and the type of screening that we're doing currently in our prisons and jails is that we're not able to break down, if someone has an intellectual disability versus someone who has a mental illness. We have more data on mental illness. And so we're really working to bring more focus as well on intellectual disability so we can know how to serve this population better and, have a better understanding of what our model supports for people with IDD in prisons and jails. Another important thing to remember is that there's issues around people with disabilities and law enforcement, and we know that between 1/3 and 1/2 of those killed by law enforcement are people with disabilities. And while we don't have strong data in this because it's not kept through, traditional law enforcement, this is coming through media reports, and there's been attempts through media to really try to take a look at all of the things that have been reported through media and bring it into one space so that we can kind of get an idea of how often this is happening. And we know that people with psychiatric disabilities are making up a majority of that. And also 70% of prisoners with psychiatric disability are serving time for nonviolent offenses. So these statistics just kind of help us get a better understanding of why it's so important that we address this population specifically and start thinking through, like when we were talking about the Pathways to Justice model earlier, what are some things that we can do before the person even comes into the system? Are there steps we're missing in any of our fields that we could be doing better in order to prevent people going into the system unnecessarily? And Karen, you do such great work within the victims world, and I'm going to pass this over to you to talk more about victims issues.
Thank you so much, Leigh Ann, and your points are so well taken, and those statistics are riveting. It's just unbelievable. And now when looking at victimization, well, I myself have worked a lot with folks who have an intellectual disability who have been sexually abused. And recently we heard a statistic through NPR from Joe Shapiro, and his research said people with intellectual disabilities are 7 times more likely to be sexually abused than people without disabilities. So that's crazy, but that's been my experience of working with folks, and I hear these situations over and over again. I think earlier Leigh Ann had pointed out there's so many risks, and the risk of sex trafficking, they're often victims of that as well. So many situations, and children are 2 to 3 times more likely to be bullied who have intellectual disabilities. I think we all know that. We've all seen that. It's riveting. I did a really quick situation. I did a group. I don't know, many of you may have heard about Ellicott City in Maryland being flooded. So there was one provider who had a center there. They had like a Goodwill type, but not Goodwill, like a thrift store. And they had a number of folks working at the thrift store, but it was all closed down because everything is closed down there. It's been flooded out. And the folks were very upset because they couldn't work there. So they wanted me to come and process. Every time it rained, they would get more upset. So I did a group to process, what was going on. And it was very interesting because the real trauma that came out, they understood that, okay, it rained, and yeah, it was upsetting that they couldn't be at work, and it actually might be closed down permanently because of the location. This might not be happening. But they were very concerned. One man talked about being bullied at an outside job and being screamed at and called the R word on the job. And, even though he theoretically wanted that outside job, he was terrorized that he would be bullied again. And then all of them began to open up about different bullying experiences they had had. And, it's something because I realized that was the real trauma. And that was where they were just re-experiencing it and very, very upset over and over again, reliving it as though it just happened. And they were telling me about all kinds of bullying situations back into middle school, high school, and these were adults. So we can't underestimate the effects of social trauma and bullying. And there's even a term now for suicide from bullying, bullicide. Like, why is that even a term? And, folks with intellectual disabilities also do try to kill themselves. It's just not always in an obvious way. But there's a lot of victimization. I know the Bureau of Justice Statistics, in July of 2017, released a statistic saying people with disabilities are 2.5 times more likely to be victims of violent crime. So it's a reality, and it's a frightening reality. So tips of identifying folks with disabilities. I think it's really important that we know when we're dealing with the public and we're dealing with different people in different situations, that some folks have difficulty in communicating and they will shut down, or they have problems using words and don't use words. So rather than assume that somebody is refusing to talk, we want to slow down, lower our voice, take our time, and be as gentle as possible in trying to communicate, especially if that person's in a heightened state of agitation. Then there's, on the other side, there's those folks who are easily influenced and eager to please. Leigh Ann pointed out that, you know, people will actually agree to crimes. Many years ago, I worked with a gentleman who was at the scene of a murder, and the police interviewed him, and in his zeal and wanting to please the police, he said he did it, and we all knew he didn't. He wasn't even capable of that. He was in jail for 3 years. This is in Baltimore City, and his public defender was not engaged at all. We were finally able to advocate for him, get a different public defender, but it took forever. So this happens more than people realize. And again, trying to hide a disability, trying to please, unresponsiveness or the inability to use words does not mean that someone is being defiant or non-compliant. And then there are those that are really triggered by the presence of a policeman. They see a uniform and it traumatizes them because they go back to maybe times in their childhood when they saw parents arrested or other kinds of, you know, bad experiences that we don't even know, and they may just start attacking because they're having a flashback or they're having a trauma response of a whole nother level that's not rational, and they're not deliberately trying to hurt anyone, but they're trying to protect themselves because they think they're in danger from these flashbacks or memories that they're being flooded with. And I've seen that happen a number of times. And I've seen people run away and then be attacked as though, you know, you must be guilty, or, you know, tragic situations have occurred. And of course, we see folks who can't make eye contact, and we see a lot of that with autism. So within the working with folks with autism and within the folks on the spectrum in that population, we have to be so careful how we approach them. So we don't want to touch the person. Physical touch can be very, very triggering. We don't want to approach the person from behind. I actually was asked to consult in one case where this gentleman had a charge of an assault charge, because somebody came up from behind him and he startled. It turned out he had autism and he had been homeless with a homeless mother for much of his life. And then when he was 18, the mother said, "I'm done with you." So he was in a men's shelter. Somebody came up from behind him and he grabbed a rock and threw it at him, got charged with an assault. And only when he was in jail did he finally get assessed as having an intellectual disability and having autism. Just went through the school system because he didn't speak very much, not being detected. And he actually had a startle response and was protecting himself, wasn't deliberately trying to assault anyone. And they actually told him when he was transferred from the jail into a facility that supports people with intellectual disabilities, but was a locked unit. And they said to him, "Well, you can go to the community if you listen to us and do what we tell you to do." And at that point, he stopped doing everything they said to do. So he stopped showering, he stopped cooperating, and I was called in because we have this person who's so non-compliant, he has horrible behaviors, and he won't do anything, and it had been 9 months since he had taken a shower. Well, it turns out, number one, if you're a male in a Baltimore City homeless shelter, and you've probably been sexually abused in a shower, so you've been victimized right there. Number two, he was probably victimized in jail. And number three, when they told him they would send him back out to the community, he did not want to go. And they believed that he didn't use words at all. But after a while, when with just the one staff person that he trusted, he opened up and said, "I like it here. They have good food. I have my own room," and started talking and saying how he felt safe and he liked it there. And so we said, "Can you stay for a while?" And now, finally, when they understood that this was a person with severe trauma who wasn't a dangerous criminal, but was actually a victim of a series of crimes, we were able to support him differently. And he is now actually in a community provider and doing much better. So, you know, these impulsive behaviors can often be trauma responses, or people are triggered in ways that we don't even understand, not intentional crimes. So specific accommodations, I think it's so wonderful. I see many now, many policemen being trained. There's many wonderful trainings out there. I know Leigh Ann coordinates so much of this, and it's such important work to really train law enforcement officials and on working with folks with disabilities to take extra time, to be very clear, to speak on a very low level, to use a low tone of voice, to be gentle, to use simple language, maybe even pictures. If the person has a communication device, you want to find out about that. Is there something they're using to communicate that will help? Is there a person, a staff person, a family member that needs to be with them so that they can express themselves? What can we do to help this person to really talk? So many people shut down and they really need support. How can we really support them? Many cannot write and don't want people to know that they can't write. So can we help them in filling out forms or making reports? What can we do to accommodate those folks? And then finally, we want to make sure that you understand if somebody is not making eye contact, it's not because, again, they're being non-compliant or deceptive or they're lying. Carly Fleischman is a person with autism, and I highly recommend her videos on YouTube. And she talks about the fact that her mind is taking 1,000 pictures of somebody's face in one moment when she looks. So it's so intense and so difficult to look at someone's face or to make eye contact. And, she just can't and do anything else. And then, we want to make sure that we don't just ask yes or no questions because, again, as we've said earlier, people might say yes when that's not really the truth. But out of their anxiousness to please, or they're just pure anxiety. And we want to ask as many open-ended questions and give the person as much time as possible to really be able to describe their experience. And we don't want to do anything that's too confrontational because folks can shut down or they can become triggered, maybe even combative, not understanding the situation. So we want to be gentle, use that soft tone of voice, ask open-ended questions, and give as much time for response as possible. Okay.
All right, thanks, Karen.
Thank you.
So we've talked about how to identify people with intellectual developmental disabilities, and then we moved into some ideas for communication, and now we're going to move into assessing the situation. But before I do go there, I wanted to mention something about identification. I'm sure you're thinking to yourself, as we often do when we provide trainings like this, it's just going to be impossible at times. Especially there's no physical way to tell if someone has these types of disabilities. So one tip we'd like to offer is if you have any thought that someone might have a disability like that, because of a behavior or because of the way they're responding, or you have additional information somehow about the person that might cause you to think a disability might be happening, then you can always ask the person, how can I help you? Try to get to the meat of what they might need. And that, instead of having to directly ask about disability, that might clue you into what they need at that moment to feel safe or to feel comfortable in order to talk to you. So that might seem a little oversimplistic, but it really can help in those situations just to give the power back to that person when it is safe to do so in order to allow them to then open up and communicate. And it's also helpful to have a support person around who can help with that. So we're not asking individual professionals to know how to diagnose people with different types of disabilities like this, but to really try to be more sensitive to these issues and then know what kinds of questions you can ask to play some detective work there and try to get a better knowledge and context of the person and how you can best support them, how to keep the situation safe. So let's move on to assessing the situation. This is an example from a crisis intervention team that we provide, that we sort of go over in our training, and this is from the Virginia Crisis Intervention Team. And I wanted to share this to show an example of how we can apply this to people with intellectual and developmental disabilities as well. So for those of you on the webinar today, I know many of you are aware of Crisis Intervention Team training, and it's a great tool to use to really help officers better understand how to handle situations involving people with mental illness. And there is also some focus on intellectual disability as well. But I wanted to give an example of a case you may have heard of before, Ethan Saylor, and we actually highlight Ethan's story in one of our videos. And what had occurred in Maryland is he is a young man with Down syndrome who wanted to see a second showing of a movie. And so at the movie theater, when he went back to see the second showing and he didn't have a movie ticket, some authorities who were there, who were actually off duty, were alerted, and they had actually ended up taking him down to the ground, and it led to him dying due to asphyxiation. So there were points along that where the support person was around and was asking the officers to wait for the mother who was on her way. And there was a situation here where there could have been something done just to wait a little bit longer. And this is where that first point of don't take risks, whether it's the officer's safety, the correctional officer's safety, the person with the disability safety, that we need to think about the safety issue for all, and to ensure that if we have time, then we can take more time to wait and wait on the support person to arrive, or ensure that we're listening to the support person in those situations to know the individual well. So I just give that as one example of why it's so important to take these different accommodations into consideration when working with this population. Some other examples they give is to slow down, as we had already mentioned, and not shouting if at all possible. All of these things can quickly escalate the situation, especially for people with disabilities. And then continuing to try to establish communication. And it can be as simple as, what's your name, how can I help you, putting the dialogue in a situation where they feel empowered and where they don't feel completely out of control. And that can really help individuals feel more safe and more likely to talk to the officer or to whomever they're working with. We also had mentioned about triggers, and triggers are basically those things that can occur in a person's life who has a disability that can really put them in a totally different headspace. And as Karen mentioned, these are not acts of defiance. These are just everyday behaviors or experiences that people with disabilities feel. And I think the more that we all in our society understand that, if we ourselves don't have this type of disability, it can help us be more sensitive to the needs of that person and can help create safer situations. So whether it's a sensory issue, such as being in crowds, which can cause high anxiety for people with autism and other types of developmental disabilities. And I know many of you have probably heard of this because we do have more training out around autism issues. Sounds and noise can often create high anxiety. It can be very, very loud to them. Even, a tag on a piece of clothing can be highly distracting for them as well. So things that may bother us is really out just so much more pronounced in the lives of someone with autism. And so that's something that as you're talking with someone and trying to de-escalate situations, to think through what are some things that may be causing them to escalate. It may not be something that you're doing. It may be something going on their body. It may be the lights flashing, to think through all of those potential triggers. And then anytime there's an unplanned event or changes in plans, this is often a sure sign that people with autism are feeling less comfortable. And it can be something as simple as saying, first I'm going to sit down with you, and then we're going to talk about A, and then next I'm going to call this person. So it's providing very in plain language an understanding of what's happening. And again, that gives sort of the feeling of control back over to the person. And we've been working with the International Association of Chiefs of Police around their model policy. They recently revised that in August. Well, it felt recent, but now it's already June 2018. But we worked with them for over probably a couple of years in revising their model policy on interactions with people with intellectual and developmental disabilities. And this just gives you an idea of what's in that policy. First of all, in looking at custody, one of the things listed is not incarcerating the person in a lockup or other holding cell if at all possible, not incarcerating the person with other people, because as we talked about, the dangers around that and the likelihood of being assaulted. It should be noted as well that during the booking process, the person that has an IED should be classified and assigned to the appropriate housing unit. And that was discussed earlier in the case scenario that Deidre pointed out. And then no person with a disability is to be housed in a medical unit unless treatment is needed. So there's been these situations too where there's a question within the correctional facilities, where does this person belong? You know, this person has an intellectual disability, not a mental illness. There is no medical issue, but they were kind of afraid to put this person in general population. So those are real issues that we are faced with. And, you know, there's not within the criminal justice world a lot of place where we can say we know that in this certain situation the person with IDD is the safest. And so it's been a challenge to say, where does this person belong? And that's why we're so careful to say, first of all, prevention, and looking at how do we keep people out of the system who don't need to be in there. But once they're in there, if at all possible, having situations that really support people who have that disability specifically. And then using calming and reassuring language and de-escalation protocols, of course, is always important. And how we end the training is we provide a card to help officers and others who work with this population to remember 3 steps. And the first one is really to look deeper. So if you have any feeling that a disability may be present, is to take a step back and try to get like more of a bird's eye view of the situation. And remember that these hidden disabilities are often identified by behaviors and not appearance. So, you know, it's important to have this background in this training just to know that certain behaviors, or if someone is responding in a certain way, you could be able to say, well, I think that's a trigger, or that could be a trigger. And if you can either talk to the person directly about what they need as a way to get more information and see if a disability might be present, or if you could wait and talk to a support person, a parent, another advocate, a support provider, that could also help provide you with more information. Secondly is to slow down. So these are some of the things that of course are already used in CIT training, to call the supervisor or support staff to the scene if you have time to do that, and to call the person's family member, support staff, or advocate. And that's where it's important to know what are the community resources so that you'll know who to call on when there's an individual involved that has an intellectual disability. And then lastly, just to ask, you know, what's really going on and how can disability be playing a role. So if keeping these 3 steps in mind can really help when it comes to prevention overall. And I did want to circle back to the Americans with Disabilities Act And this just provides an overview of the different titles that are within this law. And what we're focusing on today, and for the purposes of criminal justice and law enforcement, is Title II, which covers public programs and activities for state and local governments. And actually, it was because of this law that I was originally hired to come work for the ARC of the United States in '94. The law had passed not too long before that, and we were at that point asked to provide training, provide brochures on this topic specifically, and really start providing the criminal justice community with ideas and information on how to provide accommodations. So the ADA urges officers to identify the disability and respond appropriately. And again, it's not just a nice thing to do, as we were saying earlier, but it is the law. And what we're looking for here is not lenient treatment, and we're very careful to point that out in any training, because this is called the criminal justice system. But we do need effective accommodations. So it's not about lenient treatment, but it's about how do we equalize the criminal justice system so that whether you have autism or you have a mental illness or whatever type of disability you have equal access to that system. And I mean, the most basic example that you may be familiar with is that many years ago we didn't even have ramps going into our courthouses, and there's still courthouses that don't have ramps. So how does someone who uses a wheelchair, for example, have equal access to our criminal justice system? And that the same thing applies to people with intellectual and developmental disabilities. But I've found over the years that it can actually be much harder to explain what are some of those accommodations because it's not a physical disability. So Title II of the ADA prohibits discrimination by state and local governments, and it impacts virtually everything officers do. And it was not too long ago that the U.S. Department of Justice came out with examples and resources that criminal justice entities can use, and they do state exactly, you know, who we're talking about here when it comes to who falls under the ADA. And this does include police and courts, prosecutors, public defense attorneys, jails, juvenile justice, and correctional agencies. And in this, which, you know, before we did not really have much examples to go by. So in this sort of guidelines or guidance from the Department of Justice, they provide some really practical examples of how the ADA can be applied. And I'll give you a few examples of those. Trained law enforcement officers should consider providing time and space to calm a situation. They should dispatch a crisis intervention team or officers trained in de-escalation techniques to the scene or involve mental health professionals. They also give an example of implementing policies that in situations where a prisoner with these disabilities shows some type of disruptive behavior that does not pose a significant safety threat, to encourage staff to seek assistance from prison-based crisis intervention teams and mental health professionals. It also provides examples for communication, and we went over that as our second step, but trained staff and officers can use effective communication methods such as plain language to convey an oath or a question. Also, you can check for understanding by asking people to explain what you just said in their own words, and then giving people time to read documents or providing documents that are less, have less words on them and more pictures. And I think another important thing to point out is the principle of, you know, universal design. The more that we create accessible things, whether it's in the criminal justice system or in our society as a whole, the more that we do that, the more we can provide supports and services to general population. So this doesn't just help people with disabilities, but it helps many others who are in the criminal justice system and those who are victims as well that we're trying to help. And for the last two slides, I wanted to mention this notion of crisis prevention versus crisis intervention. And one of the things that we talk about in our Pathways to Justice training is that it's important to think of this and perhaps to do a paradigm shift around how we've viewed how we approach this issue. Even the training that law enforcement are getting is called Crisis Intervention Training, or CIT. And this training mostly is focused on people with mental illness. We do have some focus on intellectual and developmental disability, but it primarily, if, say, for example, you have a 1-week training of CIT, then you might have 2 or 3 hours on intellectual and developmental disability. So we're looking at how we can raise awareness within the CIT training as well on IDD issues. And this is one of the things that came up as we were thinking about how to do that, that we want to start at the beginning, before a situation arises, and think about how can we start at prevention before we have to actually intervene. So CIT, as I said, focuses primarily on psychiatric disability. We also have to think about the definition of crisis and how, say, for example, an officer or a correctional officer might view or define a crisis versus how a parent who has a child with a disability sees that same behavior. We talked about triggers earlier and how that can lead to certain behaviors. To an officer, that could look like a crisis waiting to happen. But to people who are familiar and work with or live with people with disabilities, that's an everyday occurrence. So that's one of the things we're looking at, is how do we define crisis, and how does that set us up within our criminal justice system, and how we are stereotyping potentially people with disabilities, and how it sets us up to respond in certain ways. So we want to watch out for those false assumptions that we may hold of people with disabilities. This also is, when we think about prevention first, it really redirects our focus to building relationships between law enforcement and people with disabilities themselves. There is a great program called the Growth Through Opportunity Program out of Virginia, where one officer, he's a retired officer, started bringing in people with disabilities to the police departments for about 15 weeks to help them understand, you know, what law enforcement do, but at the same time, law enforcement officers are able to build relationships with people with disabilities, so that they're not only maybe have training in this area, but now they have actual relationships, and they have their own point of reference to refer to when they come in contact with people with autism and other types of intellectual disabilities. And the bonus of that is that it's also set up so that people with disabilities can then find employment in the community. So it helps them with that issue, with, you know, finding employment, which is a huge issue in the disability world, but also it really helps develop those relationships. And of course that can help when a potential crisis happens. The more an officer really knows firsthand how to interact with someone with disabilities in a situation where there was not a crisis, the more likely they're going to feel comfortable when there is one. So the goal in looking at kind of reframing how we see this is to proactively create the safeguard against potential crisis. And I'm sure many of you are familiar with the term procedural justice. And within our National Center on Criminal Justice and Disability, we've been working to really incorporate procedural justice into how police and criminal justice professionals can respond to people specifically with intellectual and developmental disabilities. So there are really 4 prongs to procedural justice, which are listed here. The level of fairness that officers are providing to people in the community, to people they interact with, giving people, citizens, voice whenever they come in contact with law enforcement, making sure there's transparency and impartiality. So it's looking at officers, you know, staying neutral, relying on facts, not relying on biases or stereotypes about people. And this is really important when it comes to people with disabilities. You know, we all carry certain biases against people who are different than us. And the less we really know about a certain population, the more likely that we will hold certain biases because we don't know that person personally. So procedural justice is really a great tool that we found to be helpful in talking to the law enforcement community as a whole about how to ensure people with disabilities are part of that conversation. And we actually had an article published in IACP's Police Chief Magazine that there's a link there on the slide, kind of getting more into the nuts and bolts of how that looks. And we're also talking to researchers who are applying procedural justice to people with mental illness right now and talking about how that can be expanded to looking at people with intellectual disabilities as well. So, Karen, I'm going to hand it back over to you to talk about how to enlist support.
Yeah, thank you. And that's so helpful and so important, Leigh Ann. You know, that prevention model is everything. And working towards prevention, I think, really changes, like you said, it's a paradigm shift. And part of that is enlisting support and the bridge with the disability community. So the disability community is there, they're active, and there are many folks just ready to help screen, to help write protocols, to help really build bridges and support in every possible way. I know there's a lot of trainings going on. There's more people who want to do trainings, and it's something easy to access. So I think this training is fantastic that you do, Leigh Ann, and I know you've had a big impact already throughout the country. And I think we need to just look at how more of that can be done. And so many situations which are misunderstood. So I'm going to just share a brief story, but just epitomizes the misunderstandings that go on. With one young woman, she had a horrible childhood. She was born to a mother with a serious drug addiction and horribly sexually abused by her father, then put into foster care, had another abuse situation there, then put into a juvenile facility for years where she just became more and more difficult because, you know, she had so much trauma and mental illness, mental health issues, you know, understandably. And then she aged into the adult provider community, and she had a staff who one day was mad at her because she had cursed her out, whatever, used bad language. And the staff locked her out of the house. And this young woman had been abandoned, had been rejected so many times that she completely saw red. She had a very severe trauma response. And when the staff let her in, she attacked the staff. The staff pressed charges. Now this woman got an assault charge and was put in jail. And again, this whole system not working together, not seeing prevention. When they called the police just said, yeah, you got assaulted, you want to press charges, and no one realizing, oh, this is a very traumatized young woman who, yes, it's not good what she did, but at the same time needed support. So it took a while before she was really identified as someone with severe mental health issues and really needed support. But when she was finally put in a more therapeutic setting, she was able to get treatment. I was one of the people treating her. We were able to do trauma work with her, and now she's doing really well in a community agency. So much is just understanding who people are, what they've been through, what disabilities they're grappling with, you know, where that intersection of intellectual disabilities and mental health issues lie, and how can we really support. So the more bridges we can build, the more we can work together, the more we can help. Thanks.
Thank you so much, Leigh Ann, Karen, and Maria. We have a few moments for some questions before we wrap up. So the first question I have is, can those with IDDs regain competency? This is a multi-part question. Is institutionalizing them beneficial if they lack decisional or rational ability?
Well, gee, I wonder who's going to answer that. But actually, you know, most cases you can't gain an intellectual competency because you are where you're at, but you definitely can gain coping skills. You can gain more self-regulation, emotional skills. I've worked with many, many people who have learned to really master their impulses on many levels and who have learned to ask for help when they need it. So I believe that institutionalization is counterproductive and more therapeutic settings are the best possible way to go, but that's my belief.
Yes, and I appreciate that question because it's actually something that drove our national center to write a white paper on competency issues and really try to help advocates understand this question better because, frankly, it's confusing. And so, as Karen said, you can develop skills. All of us can improve at skills, but your intellect is not necessarily going to increase. So that's where, if we're expecting, people with disabilities' intellect to change in order to regain some type of competency, in order to, actually access back into the criminal justice system, that's where we're seeing people pretty much in limbo for years. And so we have to look at using more appropriate measures. We have to look at how are we basically keeping people in the system without any other way of addressing what that, what behavior it was that got them there. So another area that we did a webinar on was mental health courts. And this is where we've seen the question come up again, how effective are mental health courts as well at addressing this population. And that webinar was very interesting in that, we got mixed responses on that. But often, people with IDD do face different challenges. And we need to be aware of that and make sure that services are provided that allow for a better understanding of people with IDD as well as mental illness. And I think that goes back to the whole issue of the hidden population, and that this really has been sort of a hidden population, even within disability more generally. And so we need to think about how to bring those more to the light. And I would, again, point you back to our competency white paper to get more information about that really what could be a much more longer answer, but that's available on NCCJD's website.
Thank you. We actually had questions from a couple people about the two white papers that were mentioned. So if you could list the name and the specific information about the juvenile white paper and the competency white paper again, I think a couple people were hoping to be able to jot that down.
Sure, no problem. So if you, and I think this could work if you Google NCCJD publications, white papers, that should take you to the direct website where we house our publications. The one I just mentioned is Competency of Individuals with Intellectual and Developmental Disabilities in the Criminal Justice System. That can be downloaded. The other one on juvenile justice is called Justice Involved Youth with Intellectual and Developmental Disabilities. We also have one, those are our first two listed when you go to our website. We also have one on sex offenders, which was a huge issue that came up as we started offering these different webinars. That was our most attended. And then violence, abuse, and bullying affecting people with IDD was another white paper we did.
Thank you so much. The next question is, what should we know about people with IDDs that may help mitigate their circumstances at sentencing?
Leigh Ann, why don't you take that?
Okay, sure. I was giving you a chance.
Yeah, we're both waiting. No, I think that's definitely something you have great expertise in.
Great. So that's a great question. And one of the first things that come to my mind is to know the resources and know who to call. One of the things that we've offered through our National Center on Criminal Justice and Disability are individualized or personalized justice planning that really thinks through what is the best outcome for this individual, what kinds of resources are in the community so that we can keep the person in the community and ensure that they don't get, locked into the criminal justice system and cycling through that. So one of the chapters that we work with a lot on is the ARC of New Jersey, who's been providing this type of support for years through their chapter. And we're really looking at how can, we work with the community to identify other ways to keep people out of the system. So I remember early on when I was working on death penalty cases, just the focus on mitigating circumstances and really many of the things that we talked about in the webinar today about things to look for, looking at school records, knowing how to, be able to document that a person had a disability, and then knowing how to use that information so that the court understands it. There's strategies around how to do that, and then there's just, on an individual basis, people really being sensitive to the possibility of disability and ensuring that the courts understand that. So at our National Center, we have an information and referral service where anyone throughout the country, including parents, people with disabilities themselves, law enforcement, attorneys, can call in and ask for support around these types of issues. And I will mention that one of the calls that we're getting quite a bit is around sex offense cases. So if you know of anyone that needs that kind of support, we would really urge you to let them know about our center and how they can get support on those kinds of questions.
Thank you so much. I think we have time for about one more question. This question is geared more towards those with dual diagnoses. They can be a danger to themselves or others. Is there a possible solution other than institutionalization that would allow them to get better, so to speak?
Oh, that's a wonderful question, and
That's definitely yours, Karen.
I'm so adamant about treatment and therapy, and it's another bridge that we need to build is a bridge between the mental health community and the disabilities community, and I'm working very hard on that bridge because I strongly believe that people with intellectual disabilities really benefit from therapy, and I've done it for 30 years and trained many therapists, and we've seen so many people just get better, not need to be institutionalized. It's not needed at all when we can provide treatment and supports. The other critical issue is the training of the frontline staff and of families, and how we can help families to understand the mental health issues of folks with ID and also give that support. I think that's really critical as well. So thank you for that fantastic question.
All right, thank you both so much. I want to thank Leigh Ann, Karen, and Maria again for taking the time out to present today. And I want to thank everyone for joining. I will leave our contact information up for a few minutes. If you have any additional questions, please feel free to reach out. Thank you.